What causes bleeding nipples when breastfeeding? Imagine the first few days of nursing and feeling a sharp sting or noticing blood on your nipple. It can be confusing and worrying, but understanding what causes bleeding nipples can help you find relief. When your baby latches onto your breast, their mouth should cover most of the areola, not just the nipple. If the latch is shallow or incorrect, it can cause friction on the nipple skin. This friction can lead to small cracks or grazes that may bleed during or after feeding. Early on, both mother and baby are learning how to nurse, so this is common. Cracked nipples are often caused by improper latch or sucking technique. If the baby's mouth isn't wide enough, they might pinch or scrape the nipple, creating tiny tears. These cracks can bleed and cause pain. Sometimes, the nipple skin becomes sore and inflamed from repeated trauma. If the cracks are deep, bleeding might occur, especially during a vigorous suck. Infections like mastitis can also cause nipple bleeding. Mastitis happens when a milk duct becomes blocked or infected, leading to inflammation. Symptoms include redness, swelling, pain, and sometimes fever. If the infection damages the skin, bleeding can happen. It's important to treat mastitis early with proper antibiotics and continued breastfeeding or milk expression. Skin conditions such as nipple dermatitis or eczema can cause redness, itching, and cracking. These skin irritations might be triggered by soaps, laundry detergents, or fabrics that irritate sensitive skin. When the skin cracks, bleeding can occur, especially if the irritation is severe. In the first few days after birth, some women experience rusty pipe syndrome. This is when increased blood flow to the breasts causes a reddish tint in the milk. Sometimes, this can cause minor nipple bleeding or small blood spots in the milk. It usually resolves within a few days and is not painful. Less common causes include trauma from nipple piercings or underlying breast conditions like ductectasia, where milk ducts widen and may become infected. Rarely, breast cancer can cause nipple bleeding, but this is very uncommon in breastfeeding women and usually accompanied by other symptoms. As a mother navigating newborn care, knowing that nipple pain and bleeding are often linked to latch issues or skin problems can be reassuring. Seeking help from a lactation consultant can make a big difference. They can guide you on proper latch techniques and help prevent or heal nipple damage. Applying breast milk or lanolin after feeds can soothe and promote healing. Avoid harsh soaps that can dry out the skin, and if symptoms worsen or signs of infection appear, see a healthcare provider promptly. In short, bleeding nipples during breastfeeding are mostly caused by mechanical trauma from improper latch, infections, or skin irritation. Addressing these issues early can help keep breastfeeding comfortable and successful.